Is being black bad for your health? And do the color of your skin and your race have an impact on the type and level of medical care you receive? Well, if the medical care is provided in the United States, sadly, race isn't just one factor, it's often a determining factor in the care provided by doctors, nurses, and healthcare professionals across this country. My guest today is on a mission to expose the gross inequities and racism in the U.S. healthcare system, from medical schools to operating rooms. His story coming up next.
Live from Los Angeles, this is the Special Report with Areva Martin.
Studies show that having more black doctors would improve the health of black Americans. Yet, the percentage of U.S. doctors who are black has barely risen in the past 120 years. And there is still a wide pay gap between white and black physicians. In the 1990s, blacks were 12% of the population, but only 1.3% of physicians. In the 1940s, blacks were 10% of the population and 4% of all physicians. And in 2018, just a couple of years ago, not much had changed, as blacks were 13% of the population, but only 4% of all physicians. The numbers of blacks enrolled in medical schools is equally dismal. But given the direct correlation between black health and black doctors, you can't help but wonder what is preventing the growth in the number of black physicians. Well, Dr. Damon Tweedy, a professor of psychiatry at Duke University Medical Center and a physician at the Durham Veteran Affairs Medical Center, is the author of a New York Times best-selling book that answers many of these questions and more. I want to welcome Dr. Tweedy, author of Black Man in a White Coat, A Doctor's Reflections on Race and Medicine. Congratulations, Dr. Tweedy, on your New York Times best-selling book. That must feel really good to know that your first, book out the gate has gained such, praise and national attention and made the prestigious New York Times best-selling list.
Yeah, it definitely was a surprise to me. But I think in many ways, obviously, it's a reflection of all the other things that are going on in this world, and that's generating interest in the world of how race intersects with medicine and health. So it's all kind of connected, but I'm definitely honored for sure.
Well, I first want to start by asking you the motivation. When someone looks at your resume, they see all the amazing things you've done in medicine and science, and they wonder, a book. What inspired this doctor with these incredible credentials to, share his story? Because the book is really a personal memoir about your own experiences, both in medical school and as a physician. So what was the motivation?
Well, I think there's so much behind the door that happens in medicine. The public doesn't really know about a lot of fascinating stuff, but also a lot of not so great stuff. And I think it really just started with me sort of always being interested in stories that are written about medicine and healthcare, and like the TV shows about medicine and all those sorts of things in the books that are written. But what I found as I got through the journey was that as I was going through the journey, a lot of perspectives were missing. And the most obvious one for me, the most glaring one, was this story about what does race mean in the healthcare sector, because it's like a lot of these stories just kind of glossed over it. Like it just wasn't, maybe they didn't want to talk about it. Maybe they felt uncomfortable. Who knows what their motivations were, but it felt like there was something missing. And I sort of felt like in some ways when the book started, it didn't start with the idea of me wanting to write a book. It was really this idea of me thinking like almost like writing a letter to my younger self kind of thing, or like the next generation. Like these are the kind of things that you experience, you deal with. This is the journey, this is how you might handle this kind of situation. And it just kind of became something more, but it really just started with like a diary of sorts, and just kind of over time it expanded to something more. But really, it was giving voice to the patients that I saw in the world of medicine, but also giving voice to what it's like to sort of be that black person who's a professional and navigating that world.
Well, the title, Black Man in a White Coat, and the cover artwork is literally a Black doctor in a white coat. Help us understand the importance of the white coat ceremony, to the medical profession, because I know this is a big deal. I've actually been to one of these ceremonies, but tell our viewers what it means as a doctor to get this white coat and why this is important to your title.
Yeah, so basically, every first-year medical student, just about all medical schools nowadays, they have this kind of white coat ceremony where you go in. It's like your introduction to the profession. It's like this idea of like this is the symbolism of you being sort of transferred from a layman or sort of the everyday citizen to this other thing, like this professional. And there's all these sort of ideals that are sort of attached to it. But of course, there's these ideals, and then there's also the reality. And so a lot of what the story's about is sort of how do those things conflict, and what is that journey like? So that's sort of kind of what I was exploring. But the idea for the title actually just came up to me one day. I was in the shower, just taking a shower. My white coat was hanging on the rack. I was getting ready to get dressed for work. This point I'm starting to write the story, and then I'm there, and it just kind of all just kind of came. I looked at myself in this full length mirror, and all just kind of came together. That this sort of puts it all together in the most simplistic kind of way, but also in a way that gives imagery and is evocative.
Yeah, I love the title, and I love the image on the front of the book. And what you do is tell us, okay, here's the symbolism of the white coat to the medical profession. But when you take this white coat off, then here's the reality that a Black student like yourself. In the first chapter, you talk about your experiences as a Black student at Duke Medical School. Help us understand what it was like for you to arrive at this very prestigious medical school.
Yeah, for me, so I came from a very blue-collar, working-class background from Maryland, suburban DC area, and my parents didn't go to college, and so this was all like this huge sort of thing. So here I'm not only a college graduate, but now I'm in medical school, and in a very prestigious medical school, and it's like a fish out of water sort of experience where you had so many people there who had very different backgrounds. Their parents were attorneys, lawyers, attorneys, doctors, business people, engineers, that sort of thing, and so you felt out of place there. And then there's this added aspect of being Black and what all that means. And then there were incidents pretty quickly that sort of reminded me that as much as I might have aspired to just come to med school and be a regular student like everyone else, things were different. And I had to sort of find ways to adapt to that. So one of the first sessions in class, in the book opens with the scene of me walking to the classroom after a break, between lectures, and the professor confronts me at the front of the lecture hall. He's like, "Are you here to fix the lights in the classroom?" He sort of waves his finger at me and says, "Are you here to fix these lights? And then why haven't you done this? I called you last week." He had totally thought I was someone else. And then you start running through your mind, well, why is he thinking about me in this way? And you try and think about different possibilities. And I try to be a gracious person. I don't automatically just go to this, the quote unquote race card. But then he's like, well, why are you here if you're not here for that? And it was a very antagonistic kind of experience. And it just kind of reminded me of, and then this idea of being different. And that was sort of like the beginning. And there were many incidents that occurred throughout the medical training where patients or other providers would say all sorts of things that were problematic, and you had to find ways to navigate all that.
Well, I thought it was very interesting because you tell the story, like I said, very graciously. You didn't blow up on the guy. You didn't, scream and shout, which a lot of people would have.
Yeah.
But you did something else. You made a commitment to show and to prove to this guy that not only were you not the janitor, which is what we should assume he thought you were, or the electrician, but that you were a student that had earned your place there, and that you were a top student. So tell us, I don't want to give too much away about the book, but you do something that's pretty incredible the best revenge, I think, that anyone can get in terms of dealing with that situation.
Right. Well, I'll just tell you, so as far as the story goes, you parts blowing up. There's a party that wants to do that, but I'm a black guy. I'm 6'6", so you think, whew, you can imagine how that might not have gone over so well if I would have, because I'm already thinking about that issue of threat and all these sorts of things. That's his own sort of story, right? But what I did in this particular situation is that, at the time, even now, affirmative action is always a thing. Well, are Black people qualified to this job? We keep hearing these stories over and over again. And people are saying, well, you're taking someone's spot and all this sort of thing. So some of that starts to eat at you and you wonder. And so I had to prove to myself that I belong, but of course I had to prove to this guy as well. And so for those next several weeks, I just studied almost around the clock, was so determined I had to it was like this sort of inflection point. I had to prove whether it was going to work or not, make or break. And I ended up getting the second highest grade in the entire class, 100 plus students. But at the end, I was satisfied, I was pleased, I was excited, ecstatic, right? But at the end of that course, we had to meet with the professor to check out. And that's sort of like the routine at that particular time. And just the look on his face when he saw, that exam score and he saw it attached to my face, he was in disbelief. He like went through these different stages, almost like within like a 30-second period. You could see him going through these different mental stages of trying to process what was actually happening. How could this be?
Is this the janitor that I did several weeks ago that now is the second highest grade in my class?
Yes, exactly. You just see all that happening in his mind. So yeah, I mean, it was, but it's bittersweet though, because in one hand you've shown that you belong, you've shown it to yourself, you've shown it to others, but there's also that reality that you know that you're different and you have to kind of navigate that. So it's kind of bittersweet kind of sensation. You know, in some way, yeah, you stuck it to the guy, but also you know this is not the last of it either, right? So it was that kind of experience.
And let me ask you this, Dr. Tweedy. You tell stories in the book about that experience, and another thing that really resonated with me is how you felt hearing the professors every time they talked about a disease. Mm-hmm. Every disease was somehow attached to race and attached to Black people. So whether it was diabetes, heart, cancer, whatever, you know, there was this emphasis on how these diseases disproportionately impacted Blacks. And I think I read you said it would make your stomach like turn or twist. You know, it's just got to be overwhelming for you. So I know that was happening from the professors, but what about the students in medical school? Because you said they're the kids of these, you know, prestigious parents, these wealthy parents, these super successful parents. What was it like in terms of the student body at a prestigious medical school like Duke? Did they accept you, or did they have some of these same attitudes that obviously this professor had?
So I'm glad you brought that up. So there's a lot of layers to that question, and it's a great question. So I would say, as far as the students themselves, I'd say it's mixed. I mean, I'd say certainly they were further along than some of because that professor was of the older generation, right? And so certainly they're much further along in the pathway, but that didn't mean they didn't have their blind spots, for sure. And so actually, what's been striking is after the book was published, and I got classmates from that time reached out to me. They were in disbelief. They're like, wow, I can't believe these things happen. Like, how are these things happening while I was there? So it's like the idea that, you know, if you don't experience it, you kind of go through with blinders, right? And so I think there was a lot of that sort of perception. There were a few outliers who were more problematic, but I would say on balance, it was more just this idea of like just blinders, right? Just like sort of like with the awakening so many people have had over the past year. It's like these things have been going on for so long, but it's like, oh, now I didn't realize it was like this. The point about the classroom, I mean, about the learning, what you learn in classroom about race and about health, the way I put it in the book is like being Black is like bad for your health. That's sort of the lesson that you were sort of taught with every disease. But the problem was, particularly at that time period, there was no context placed to it. It was almost as if they were saying that, okay, you see a Black person, you should just think disease and sickness and illness, but without any context as to what were the factors that were actually, why? You know, what were the socioeconomic factors? What was the structures that we have in place that were precipitating these sort of problems? This was not talked about. There's a language for it now. There wasn't even a language for it at the time. So you're just left there thinking to yourself, like, how are people taking this in? And the medical field is starting to sort of grapple with this and how we educate doctors, because in some ways they teach you to be prejudiced. They teach you, okay, if it's a Black woman with this problem, think this. If it's an Asian woman, think that. And so it's almost like it teaches you to be racialized in your thinking. And so it even perpetuates these problems in so many ways. So I think the medical field in the last 4 or 5 years is beginning to really grapple with this in a much more systematic way.
And I wonder about the isolation. So I was a Black kid from a housing project in St. Louis that went to the University of Chicago. You know, really, really, I guess about as wide a school as you can get in terms of the numbers.
I give it a talk there. I know what it's like.
Okay, so here I am, University of Chicago, Black kid from North St. Louis. And one of the things that I remember was the intense isolation that you feel on campuses like that, not, being able to find anyone that you can identify with, and always feeling like you've got to prove yourself. And I, had very similar experiences. In fact, I had a probably worse experience where I was shamed for the way that I talked, and so much so that I stopped talking for a whole semester to deal with, the implicit and the explicit, racism that exists on those kinds of campuses. What was it like at Duke in terms of, were there enough students where there was even a group of you that could get together, Black folks that could study together or could be a support system for each other? Or was it, I was incredibly isolated at the University of Chicago.
Yeah, I entered Duke at an interesting time where they were just beginning to actually increase enrollment of Black students. There was a former Duke undergrad from the old days, the 60s, who had become the dean of admissions. Her name is Brenda Armstrong, and she really made her life's mission to increase the enrollment of Black students in the medical school. So she was like this sort of, for lack of a better phrase, mother hen, and she really helped us sort of foster community. So there were a handful of students that I could sort of connect with. We also could reach out to her, and she would tell us stories about things that she had experienced, and it also helped put in context what we were sort of this longer arc of what we were dealing with. But there's no doubt that many students find those experiences really isolating. You come to a place like a Duke or Yale or Princeton, those types of places, and there's definitely that sense of isolation that can be very powerful. And I think so. I always encourage people to try and find those allies and people that you can reach out to, and connect with very early, because trying to do it on your own can be very, very difficult.
And it's funny because just slightly more Black students. So by the time I get to Harvard had more Black students than the University of Chicago, and just that small increase in percentage of Black students made such a big difference for me in terms of my experience at Harvard than at the University of Chicago. But I want to talk about Chapter 2. Chapter 2, you explore the interactions of health disparities through through stories of Black mothers. Why Black mothers? I found that very interesting that you're not an OBGYN, you're a psychiatrist. Why tell the stories through Black mothers?
Really, it was actually, this is the medical student perspective. So when you're in medical school, you go through all the rotations. You go through surgery, you go through pediatrics, you go through OBGYN. And those experiences were very powerful, because you could just sort of see, because nowadays there's much more language about how, what this is all about, but it was powerful to just sort of see these disparities play out. You think about young people, you think about health, but you think about in OBGYN, you think about health, but you also see that there are all these numbers about how Black women are more likely to experience, maternal health problems, more likely to have infant mortality or infant related problems. So I just wanted to explore that experience in that way. It is also, as a man, I wanted to sort of talk about my own sort of discomfort with it and trying to grapple with it, wrestle with it. It's not a neat, pretty story, but it's really it stayed with me for all these years. And you wonder, you look back and you see how the system lays things out and how so many bad things can happen. So it was really told from the perspective of a young, sort of naive person experiencing the power of these disparities. And perhaps OBGYN was probably one of the most visceral ones that I encountered.
Another thing I found really, I think, interesting about the book is how honest you are and your own self-reflections and your willingness to confront your own biases, because you talked about how the medical profession teaches doctors in some ways to, see stereotypes. If you see a Black person, you see disease. If you see an Asian person, you see certain other diseases. But you tell a story in the book of you confronting a poor Black man on the streets and some of the assumptions that you made about him. How did it feel for you writing a book, being so vulnerable about your own biases?
Yeah, I think I just wanted to sort of, sometimes you read biographies of people and it makes them seem like they're the greatest thing ever and that they've never made a mistake in their lives. And, that's just not me. That's not who I am. And so I think you can understand what I'm trying to say if I make myself more vulnerable, but also more, I struggle with these problems too. So, I'm trying to bring you along on these are the things that I struggle with, but these are the pitfalls of it, and how can you maybe do better? I'm trying to bring people in that way versus sort of necessarily just kind of calling people out. But it's very real. I mean, so I think people can understand. I think in order for them to understand how I react to certain situations, they need to kind of understand a little bit more about me and where I was coming from, for better or for worse. And sometimes it was definitely for the worse.
Yeah, and I think one of the things, too, that you talk about is probably the experience of every Black professional man and woman, and that's the experience you had when you were sick yourself and had to go into an emergency room, and how you were treated when the emergency room doctor staff saw you as a 6'6" Black man, in casual clothing, and not as a Duke-educated, physician, not as a Black man that had studied law at Yale and had all these credentials. Tell us what that was like. Put us in that hospital room as you are experiencing the kind of treatment that we've even heard, President Barack Obama talk about. We've heard so many high-profile African Americans share similar stories.
So yes, some people want to say that it's like all an issue of class and it's not race. And so, it's very complicated. And so here I am, the white coat's not on. So we talk about the white coat. So imagine me without the white coat, imagine me without the tie. I'm working in the yard, cutting my grass, and I injured my knee. So I'm in outdoor clothing, go to this, urgent care setting to get this knee checked out. And when I walk into the room, the doctor, not only does the doctor never gives me any eye contact when the doctor walks in the room, but then the doctor's on the computer. But then he's like, well, he doesn't really examine me. He just sort of asks me to stand up and sit down, but doesn't actually examine my knee or anything else. And, as being a doctor, I knew that there were a lot of the gaps here, right? Like, what's missing here, right? Because he's saying you can go back to work, but he doesn't even know what kind of work I do. He has nothing about me, right? So it's just the whole idea.
Ask any questions, doesn't have any information.
No, exactly. And so
like most of the visits we have to doctors, sadly to say. But
yeah, so I had to give some subtle hints that I was a medical person, and even then it was striking because then the doctor said, "Well, are you a lab tech or a health tech?" He said it's always this kind of way of like sort of kind of putting you in a box. But nonetheless, once he learned I was a doctor, the difference in care was just unbelievable. It was like, okay, not only am I going to examine your knee, but I'm going to order an X-ray, I'm going to get you crutches, I'm going to get you pain medicine. And you just imagine it's just like being two different people, right? In this one encounter, there's the first person, just random black guy off the street, right? Who knows what this person thinks about you? Then now because you're a doctor, you're a colleague, and now the care is different. That's striking. That is not a one-off. Those things happen. There's a, like I always tell people, there is this whole history of mistreatment that Black people experience in the healthcare system. And we hear about Tuskegee and we hear about all these other things. Those are the sort of textbook things, but really it's the day-to-day, everyday experience that people have, which is really what kind of carries us forward and brings this powerful sense of like uncertainty and mistrust in the healthcare encounter, because almost everybody has that kind of story of some form or another, someone in their family. And so that was one of my versions of it.
Yeah, I can't, you recounting that even when you said you were in the healthcare field, for women, I've had that experience. There's a hospital out here that I did some work with, and I had one of their sweatshirts. So people see me and they say, "Oh, are you a nurse?" So, if you're a woman, there's an assumption that you're a nurse, not that you're a physician. And in your case, you said, he started naming a list of things that you could be, but never asked you if you were a physician, automatically assuming that because you were a Black man, you had to be something less than a physician. Not that those other professions aren't, very admirable and honorable and worthy professions. But, assuming that you were not his colleague and his peer. I want to ask you, though, I know from, research, you grew up in a pretty conservative household. You said your parents didn't graduate from college, which is, first generation college graduates happens to be, pretty standard for a lot of Black professionals. But your family's pretty conservative values. How did that shape your thinking and, how you approach these situations?
Yeah. So, you use the word conservative and people think, go straight to politics. And so it wasn't as clean as that, but it's very much conservative values. And you see that a lot of traditional sort of, Black families, a lot of the sort of raised in the church, very traditional about how men and women should interact in relationships and all that sort of stuff. Right. So, but also there's a tinge of judgment when you have a certain view, like, this is right, this is wrong. And sometimes the context or nuance gets lost. And so some of that I brought into my own experience in medicine, whether it was dealing with women who were, having children who were pregnant and they weren't married, so dealing with that experience, or having women and they have a more than one dad, the judgment sort of comes in. It also came in when I was dealing with people who were, identified as, lesbian and gay. And so I'm very into the whole chapter about that and about how that could be really problematic if you sort of keep that stigma pushing forward and how there's health problems for it. So I'm very candid about how my own sort of background influenced my thinking for better and sometimes for worse. And so I'm very candid about that.
How did you check those biases? Because I know you tell the story of a teenage girl, a pregnant girl, who came in with vaginal bleeding, denying that she was pregnant, and there was whole, discourse between other doctors about whether she was, smoking crack.
Exactly.
But she's a teenage girl that was pregnant. How did you check those biases? That I know, growing up in a Black family that was super conservative religiously, not like you said politically so much, about girls
that kind of stuff.
who are not married,
Yes.
gay folks, a
Yes.
lot of judgment that we are taught in Black
Yes.
church and in Black families.
Yes.
How did you check those attitudes that maybe had helped to shape who you were as a young man?
I think it's more about and so certainly some of those values can be really helpful in so many ways, but I would say it's really more about experience. It's a part of this. The story was telling this journey, sort of seeing how these experiences opened my eyes to a different way of thinking about people and their situations. And so I think that was, so sometimes I went into those things with a lot of bias, right? And so, but then I saw this person and I got to connect with them in a different way. And I realized, wow, maybe everything I was taught wasn't exactly the right way. And I wish so much of our society could sort of do that. Like, I think a lot of our problems in our society is that people are so rigid. Like, if they think if you start to contest something about something they've done or their belief, they get so defensive that they're not open to this idea that they could improve or get better. And they say, oh no, you're attacking everything that I've known. So no, I think it was really more about just getting that experience and seeing people and seeing that there's a lot of else, that things aren't always as simple as they seem. It's not as simple as I make good choice, you make bad choice. There's context to choices. There's a lot of things that are much more complex. And so I think my journey really helped me see that in a way that had kind of going in, I was very naive.
So, Dr. Tweedy, your book, Black Man in a White Coat, comes out in the same year that Dr. Michelle Harper comes out with The Beauty in Breaking. She's a physician, emergency room physician, Black woman. You are a psychiatrist. I think the statistics say about 4% of the doctors in this country are African American. Why now? Why are Black doctors speaking out, finding their voices, talking about racism, structural racism in the medical and healthcare profession, things that have been known but not necessarily talked about, and definitely not talked about in, best-selling books by Black physicians?
Yeah, I think there are a few things, right? So I think the things that happened some years back with the Black Lives Matter movement and sort of all the things that occurred with going back, several years, that really sort of generated a lot of public attention to the subject. Certainly it was to this apex with George Floyd and everything that sort of came out of that. There's also COVID, everything that sort of has evolved from COVID and all the sort of the way in which COVID sort of put a magnifying lens on all these sort of long-standing health disparities that that those of us in the medical world have known about, but the public got to see it in a different way. So I think those factors are at work. I just think that it's long overdue. It's been there. These issues have been there for so long, and health is so central to our everyone. And so it's just such an important issue. And I'm glad that we're finally getting that space and that voice. And and that Black people. So many of the older Black doctors that I've talked to, you've really kind of written my story, or thank you for sharing this to the larger world. So for that, I'm eternally grateful to their contributions to help me along the way. So I think it's really all about those things.
Well, so obviously lots of praise from Black doctors, lots of praise from readers, even Oprah Book Club recommended your books. I'm sure you must have felt elated to have that kind of, nod from Oprah. But what about white doctors? What about your white colleagues who, and I know that I've read lots of backlash from white doctors who are saying that this whole notion of race in the healthcare profession is being exaggerated, that it doesn't exist. Some are denying the existence of it. Have you received any of that backlash from your white colleagues? Perhaps I'll say for the most, yes. The short answer is yes, but for the most part, no. So for the majority of people have been receptive and positive and encouraging and those sorts of things. But there was the Journal JAMA, the Journal of American Medical Association. They got into some hot water earlier this year because there was a podcast that they put out there saying, well, how could there be racism in medicine if no doctors are racist? And so that was just like they're just putting that out there, and it got into a lot of hot water for that for good reasons, honestly, because that was really problematic. So there's definitely people in this world who feel differently, and I've gotten lots of emails over the years of people who have said some things that they basically just flat out said that I'm making this up or that I'm being a race baiter, I'm racist. So yes, there's definitely that segment. I would say that's about 10%. So 90%.
is much more sort of open-minded about this. What worries me about the 10% is not anything about me. I have thick skin. They want to say I'm a whatever. It doesn't matter. What matters to me is I'm troubled by the fact that they're doctors seeing patients. These patients have no awareness of what these doctors' feelings might be harboring. So that's worrisome. That's what always troubles me the most with that lingering sort of 10%. Yeah, so that's kind of where we are. Thankfully, most of that 10% tends to be, so far, has always been much older doctors. So I'm hopeful that the younger and younger generations. So what makes me most hopeful about these issues is that I feel like the younger people coming into our field, black, white, and otherwise, overall tend to be have a different view than some of the older guard has about these issues, and they're much more understanding that health is not just about what the doctor does, but it's also about the larger social context that these people are, the people that they're seeing are living in, and understanding all that. So I feel like medicine is moving in the right direction, but there's no doubt we got a lot of work to do.
Yeah, I've had an opportunity to interview a lot of doctors on this show over the last 14 months, because obviously we've been talking about COVID. We've been talking about, the physical impact of COVID, the stress, the disproportionate impact of COVID on communities of color. And in doing that, have talked to doctors about, so many of these racist tropes that are part of the medical profession, like, the myth that Black people experience pain differently, a higher pain tolerance. And I've had a maternal health doctor from the South actually say that some of his younger doctors were bought into or had bought into that myth and still were approaching the profession with some of those racist tropes. So I know you say you think medicine is going in the right direction, but
slowly.
Oh, okay, great. Put an exclamation point on slowly. But I do wonder, your book, obviously great. You're telling the story, you're exposing it. Like I said, I've had a chance to sit down with Dr. Michelle Harper, her best-selling book, and others who are talking about these issues. But beyond raising awareness in a book and talking about it, what's really happening in terms of these medical schools addressing the biases and the way that you said doctors are even trained to see Black people and see disease, to see, Latinx people and see disease. Is that changing in terms of how doctors are being trained in medical school?
Yes, the efforts are beginning to happen. We're talking about things that are, med school's been teaching one way for 50 or 100 years, right? And so now a year or 2 years, you're making changes. Think about you're butting up against a lot of history, but it's also, it takes a while, right? Because these students have to then get through the system. It takes 7 or 8 years to even become a doctor who's actually out in practice. So think about how long of a process it is actually going to be if you're just training people now. You're starting it now. I think you got 7 years before they're even out. So I would say yes, it's starting to happen. One of the ways in which it's happening is that schools are starting to look at, some are much better than others at their curriculum. Like, how are we actually teaching about race? Why do we always, when we present a case, why do we have to always say this is a 30-year-old Black woman or a 40-year-old Asian, and only use that race when the person's a minority? So oftentimes you'll see if a person is white, they're not referred. It's like a default. They're not referred to by their race. So how do we even begin to unlearn? It's like a lot of it is about unlearning things. And so it's like the doctors in practice have to unlearn things at the same time, so they can begin to even teach the other doctors, the younger doctors, the future doctors, where to go. So it's a laborious process, but it is starting to happen. There actually are courses now. So this give you an example. When I was in med school, we had one afternoon where we talked about race in medicine. One afternoon. So if you were sick on that afternoon or didn't tell you're just out of luck. You got luck, right? So about 10 years later, when I came on the faculty, there were 2 afternoons in a 4-year curriculum, right? Now there's actually a course. And so within the last 3 years, there's a full year-long course that now has been expanded to include the second year, where the whole focus is to talk about these issues. They meet 50, 60 times versus once or twice. That's just a start. I mean, that's not going to fix everything, but it's like you have to start somewhere. And so I do think that we are beginning to make inroads, but it's going to take a while because it takes so long to train a doctor. And sometimes it takes even longer for people to unlearn things that they've learned that were wrong.
Did you follow the Tulane Medical School issue? So the probation that they were placed on because of allegations of racist practices. Sure. Female dean of their, I think it was the
training program.
Training program who filed a sex and race discrimination claim and then retaliation. Do you think that's the way to go? And by that I mean placing medical schools on probation, academic probation, when there are allegations of systemic racism. I'm just trying to get at what are some of the solutions that can be implemented, because at the pace you're talking about, 2 afternoons and now maybe 1 course or 3 courses. I'm sitting here thinking you and I are going to be dead, and our kids are going to be dead, our grandkids are going to be dead. This is going to be a long time before we see any real change. So, are there some more immediate things like what's happening to Tulane? Because obviously putting a school on probation, impacts their fundraising, impacts their ability to, recruit students. It has a lot of impact on that school's ability to function. Are there things like that we should be looking at to speed this process up, to get to a more equitable training of doctors, so that we could see some more equity in the healthcare profession?
Well, I mean, so there's several things that need to happen. They have to all happen simultaneously. So one is that you need to kind of work on increasing the enrollment of Black students and Latinx students in medical schools. But then that's just the start. But then you have to figure out, how do we get them onto the faculty? Because what happens a lot of times is that there's sort of this minority tax, there's this attrition that happens. People get to these schools, they have bad experiences, and they say, I want to get out of academic medicine as soon as I can. So and then open my own clinic. So you have to figure out, how do you retain people into the faculty ranks? And there's a lot of work that's involved there. And so, because many students have told me that they've gone through the 4 years of med school, and I'm the only Black doctor they've interacted with. So, I mean, that's a problem. And so you got to deal with that. And how do you creatively work to support that? The other issue is, how do you, with doctors, doctors like lawyers, you have to be sort of credentialed and have your license renewed. So how can you introduce teaching? How can you make some of that teaching and these issues a condition of your sort of maintaining your, active license? Because, because like I'm a psychiatrist, so I got to learn about the updates in my field in other ways. So maybe I need the doctors to learn about the updates in terms of, race and everything like that. That's an important piece. There's also the piece of regulation. Like, you think about, because you're a lawyer, you think about the world of medical regulation and licensure and putting doctors on notice for doing things that are problematic. And so there's a talk about, can the people who sort of issue physician licenses sort of leverage some of their power as well? To give you an example, there was a story last year where a doctor said, I heard about it third hand, but the gist is that there was a patient who came into a clinic with her mom or grandmother, and she had on a shirt that was like a Black Lives Matter shirt, and the doctor got offended and asked her to leave and escorted her out of the clinic. That's crazy from my vantage point, right? And so what is it, and so how that, but the thing is there a way that a medical board could learn about something like that and that doesn't mean take the guy's license. Maybe there's some issue, you put him on notice. You have to do something, remediation of some sort, to be able to sort of, because this is a problem, right? And so I think those are things that people are talking about in terms of solutions. So I think it's like the licensing side, there's the medical education side, but the truth is that things have to happen in like 10 different directions all at once, because the problem is so long-standing and systemic. So but I do think people are thinking about all those different levers. Can you do a malpractice suit against someone based on position, like racism or bias? That's never really been done. Is that something that's possible, right? So these are the kinds of, would that put people on notice in some sort of way? These are the things that we need to sort of think about. I'm not saying I know all the answers, but these are the things that have to happen. And I think people are creatively thinking about that because it's multi-step.
Yeah, when I just looked at the stats in terms of how, little or how small the increase in the number of doctors has been, even since the 1920s, it's just kind of shocking that the numbers have been so, historically low, that with, all the programs you think of in the 60s and the 70s to, get kids into college and to, ensure that kids are on track for college, particularly in Black neighborhoods, to see that the number of Black doctors is still, 4% of that's just it's shocking.
Well, there was a big jump actually in the 60s and 70s. So there's people who nowadays make a living out of saying that everything in the 60s and 70s didn't work, but they actually really did. There was an increase, particularly in the 70s, of Black people in the medical professions, but there's been a stagnation that the 80s and 90s sort of evolved. Medical school costs so much. Why does it cost that much? That's a question that we can think about. I wonder about what's going to come. Like people I know Michael Bloomberg has a checkered history in some ways, but he also donated $100 million to Howard Medical School and Morehouse and Meharry, and so. Couldn't that, I can think that maybe there's something that can come out of that, right? And so, because I think the cost is, I talk to some young Black students all the time about, people in middle school about it. They think about how much it costs costs. That's one is about how long it takes to train, but another one is about how much it costs.
That financial barrier.
Yes. Yeah. But so I think there's ways we can work around that. I think that's a huge barrier we need to rethink. And there's some schools that are coming up now that are being established.
Kaiser has a program that they're training doctors for free tuition.
Exactly.
To public health. So, they're leaders, bless his heart, Bernard Tyson, before he died, was such an innovative, leader in the healthcare profession. So predecessors is carrying on that same vision.
So these sort of things need to happen in a much more broad way. So I think it's all those. So I think people are really beginning to think about these. But think about it, though. 30 years ago, we kind of knew all these things were there, but there wasn't the momentum to make these things begin to happen. I think now there is at least the momentum to make some of this stuff actually happen. I don't think these solutions are necessarily new solutions, but now there's the money there's backing in terms of money and intention. So that's why I say, as bad as things have been this past year, sometimes, unfortunately, the arc of history tells us that sometimes these terrible things have to happen for us to actually progress in the way that we need to on this racial front.
Yeah, and you mentioned just briefly George Floyd. We can't have this conversation about race and racism, structural racism, without really reflecting on what his murder, how it transformed this conversation. And I know in the book you recount, you tell the story very openly, not just your knee issue, but you also have some kind of kidney, disorder that you discovered at 23. You're 6'6" Black man. A lot of the George Floyd story was his pre-existing heart condition. How did you feel listening to the news about George Floyd? And have you had any experiences yourself as other than that one in the emergency room where you were stopped by the police or experienced any kind of racial profiling?
Sure.
Just because you are a tall Black man? Oh,
absolutely. So it was one story. It was in the earlier draft of the book, but we decided to not put it in there. But yes, very much so. So as a first-year med student, actually, I was pulled over in rural North Carolina. And just had left my lab, and I was driving home to Maryland up the I-95 corridor, and got pulled over in a rural part of the state near the border of Virginia and North Carolina. And the officer said, so this is daylight. I pulled over for speeding a few miles over the speed limit. First thing he said was, boy, do you have a gun or drugs on you? You better not have either. And he had his hand on his gun on the holster of his gun. And I'm just I'm thinking to myself, how did it get here so quickly, right? Just like instantly, that's what he saw. What do you see when you see me as this person, right? And you think about all the different things. In that situation, what was striking for me was that I was dressed like in T-shirt and shorts. I was driving home, and I was trying to find my medical school ID badge. Like, I was searching for my license and registration, but really, I wanted my medical school ID badge to kind of validate myself. And just thinking about the disconnect, the irony, the tragedy, kind of all that, right? This idea that you can be coming from this fancy place at Duke, and then it just can kind of be derailed so quickly, and how people can see you. So I've had that experience. I've had others as well. It's always but that's been the most visceral one, where I felt the most, fear, because you just know how sideways these things can go. Yes, and so yeah, I think it's really important. So the other piece when you mentioned about George Floyd, where I thought you were going to go was when they talked about his death, and they were trying to blame it on these other health problems rather than what actually happened. That's also very deeply, disturbing itself. But just to answer your question, yes, I've had that experience. Most Black men in my station life have. I have two sons who are about teenage age now, and it's something I worry about because they're pretty large kids themselves, and so it's something that's it's a worry that my dad had that talk with me, and clearly we have to sort of continue down that path, at least for the time being.
Yeah, I wrote an article. I covered the trial of the officer Derek Chauvin, and I wrote an article about the irony of the defense's strategy to blame the health problems that George Floyd had, to try to make those the reasons that he died, on that day in May in Minneapolis, and just kind of the ironic nature of what happens to a Black man in this country. Someone like George Floyd, not surprising that he had chronic health issues, right? Not surprising that he hadn't had the best medical care to treat those health issues, and not surprising that he had an encounter with the police that ended, in his death. All of those things converging together on that one day, unfortunately, is the fate of so many African American Black men in particular, but definitely Black women as well.
Sure.
My last question before I let you go is really this, again, struck me in the book. You tell the story of a Black patient that you encounter in your practice who says to you basically, I don't want a black doctor. You know, they sent the second string in. They didn't send in the A team.
Exactly.
And this notion that sometimes even black people feel like black doctors aren't good enough, aren't qualified. And this notion that we've been taught for years that, you know, we should get a Jewish doctor, you know, it's in the law, you know, you grow up thinking black people wanted a Jewish lawyer. So you're having to break down those stereotypes myself. So many racist and sexist stereotypes, but right now we're talking about races. But, you know, how did you deal with that, and what advice would you have? You know, talk to the black people, because this audience is primarily African-American. Let them know that when they see a black doctor, they need not worry about their training, their expertise and experience, and you know, that there are thousands, not millions, because there are not millions of black doctors, but there are thousands of super qualified black doctors out there.
Yeah, and I would say 90% of the people out there understand that now. And so most black patients that I see are really, actually it's the opposite. They're grateful to see someone like, wow, it feels so good to see someone who can kind of help understand my challenges. And a lot of times I get requests especially for that, right? I mean, that happens a lot nowadays. So it's really more of that, but there's definitely that segment. Particularly, this is like, that story was 15, 20 years ago. You know, let's think about it. You know, like Brian Stevenson talks about this idea of how, you know, we've sort of, there's a smog that we all inhaled, right? And so how it just influences us in all sorts of ways. Because we've all been taught this sort of sense of like, the message is that, you know, white is right and that black is somehow not, right? And so, and then there's that internalized racism that people have taken in to different degrees. And so to me, that's a manifestation of that. This idea that he would see me and assume that I couldn't be good. In some ways, like, what is he thinking about himself, right? It's that whole kind of internalized, you know, racism, you know, concept. Thankfully, in that case, I was able to win him over, and then he was sort of like, yes, you know. And then we started talking about things we had in common, and it really just, the connection was there. And then he realized that, you know, he's like, well, can you be my doctor now? And so I really was able to flip that around, and so that's why I really included that story. But it's an important thing, right? Because we've all been taught so much of our challenges is that we've been taught so much about ourselves that's not good, and there's so many wonderful things about us. Yeah, exactly. And so we have to sort of think about that from the very beginning, how we're teaching our young people and how we have to continue to sort of fight through these larger narratives. And that's a big part of this larger journey.
Just last question, Dr. Tweedy, is there going to be a sequel to Black Man in a White Coat? Is there a second book?
Working on a book now in the early stages about psychiatry and mental health and stigma and then also some of that will include gender and race and those things, but it's really a much more broad topic and exploring how that stigma is really bad for people, but it's also bad for doctors because and I'm going to kind of really break that down and how it's really bad for all of us, the way we approach mental health problems.
Well, I can't wait to have you back to talk about book number 2, a topic that, again, doesn't get enough attention.
Yes.
Definitely need to talk about stigma and mental health. But thank you. And again, congratulations on this book. New York Times bestseller, Black Man in a White Coat. Make sure you pick it up. Just fascinating book, really inspiring stories and great work by you and helping us to have this important conversation about race and racism in medical school and the healthcare profession. My best to you again.
I appreciate it. Thanks so much for thinking of me.
Again, I want to thank Dr. Damon Tweedy for his insightful book, Black Man in a White Coat, and for sitting down with me and talking about race and structural racism in the healthcare field. It couldn't be easy to expose, these kind of personal stories and things that he experienced, not just as a young medical student, but also as a practicing physician. He talked about getting some, backlash from about 10% of his colleagues, but even 10% can be daunting. It can be overwhelming. It can be humiliating, particularly when you've lived through something, to have someone else try to deny the existence of your experience. I'm so grateful to him for having the courage to tell his personal story and to stand up and to expose these inequities, because maybe, just maybe, by having, these conversations and exposure, we start to get to some solutions. Just some words to live by before I get out. Dr. Martin Luther King famously said, "Injustice in health is the most shocking and the most inhumane." Dr. King said these words in 1966. It's 55 years later, and as Dr. Tweedy outlines in his book, from the cradle to the grave, health disparities abound in the Black community. From premature births, infant mortality, childhood obesity, homicides, HIV infections, The reality is Black children disproportionately bear the brunt of these medical ills. And heart disease, stroke, cancer, kidney failure, and COVID have a grip on middle-aged Black men and women, decreasing their life expectancy and negatively impacting the quality of their lives. Now, my hope is that the work of Dr. Tweedy and my guest on Wednesday, Dr. Michelle Harper, and the courage that they have both demonstrated in writing so openly about America's race problem in the healthcare system, my hope is that their stories lay the foundation so that the injustice and the inhumanity that Dr. King spoke about 55 years ago, that those inhumanities and injustices become a distant memory for future generations of doctors, of medical school students, and of Black children and adults across this country. I'm out, y'all. Be safe out there. Don't forget to wear your mask. And remember, we are all in this together. Is being Black bad for your health? And do the color of your skin and your race have an impact on the type and level of medical care you receive? Well, if the medical care is provided in the United States, sadly, race isn't just one factor, it's often a determining factor in the care provided by doctors, nurses, and healthcare professionals across this country. My guest today is on a mission to expose the gross inequities and racism in the U.S. healthcare system, from medical schools to operating rooms. His story coming up next.
Live from Los Angeles, this is the Special Report with Areva Martin.
Studies show that having more Black doctors would improve the health of Black Americans. Yet the percentage of U.S. doctors who are Black has barely risen in the past 120 years. And there is still a wide pay gap between white and Black physicians. In the 1990s, Blacks were 12% of the population, but only 1.3% of physicians. In the 1940s, Blacks were 10% of the population and 4% of all physicians. And in 2018, just a couple of years ago, not much had changed, as Blacks were 13% of the population, but only 4% of all physicians. The numbers of Blacks enrolled in medical schools is equally dismal. But given the direct correlation between Black health and Black doctors, you can't help but wonder what is preventing the growth in the number of Black physicians. Well, Dr. Damon Tweedy, a professor of psychiatry at Duke University Medical Center and a physician at the Durham Veteran Affairs Medical Center, is the author of a New York Times best-selling book that answers many of these questions and more. I want to welcome Dr. Tweedy, author of Black Man in a White Coat, A Doctor's Reflections on Race and Medicine. Congratulations, Dr. Tweedy, on your New York Times best-selling book. That must feel really good to know that your first, book out the gate has gained such, praise and national attention and made the prestigious New York Times best-selling list.
Yeah, it definitely was a surprise to me. But I think in many ways, obviously, it's a reflection of all the other things that are going on in this world, and that's generating interest in the world of how race intersects with medicine and health. So it's